Well, ladies and gentlemen, it gives me enormous pleasure now to introduce the Minister for Health, Tanya Plibersek, and invite her to the stage. Tanya is the member for Sydney. She's my local member, amazingly a mother of 3 quite young children, and a woman with a genuine commitment to improving the health and well-being of all Australians, particularly disadvantaged Australians. So welcome. Please make her welcome.
Thank you, Julie, for that introduction. It's a great pleasure to be here. I want to start by acknowledging the Bundjalung people, the traditional owners of the land that we're meeting on, and paying my respects to their elders past and present. I was lucky enough to get here to hear most of Jonathan's presentation, and I think hearing his presentation and seeing this fantastic centenarian, is that how you say it? We are, I'm sure, all of us in this room really excited about the potential of e-health, and seeing an enthusiast and a practitioner like Jonathan and seeing the potential benefits right across the age spectrum in our community just adds to that feeling of excitement. In e-health, as in our priorities across the health system, I ask myself 2 questions each time. Is it good for patients? And of all of the competing demands on the health dollar, is this the best way to spend these dollars? And I think the case for e-health has to answer those questions in the same way that every area of health policy has to answer those questions. I hear and see the benefits of e-health all the time, anecdotally. I had one doctor come to see me, a very prominent doctor, who wasn't coming to see me about e-health, he was coming to see me about something completely different, but he told me the story that he and his wife, both doctors, married, had his father-in-law living with them, and his father-in-law collapsed in the shopping centre one day because of an absolutely perfectly predictable medicines interaction when his GP and his gerontologist changed his medication independently without communicating with each other. Those sorts of stories really bring to life the statistic that we have 15,000 avoidable admissions to hospital every year because of adverse reactions to medicines. And that's just one of the many, many examples that people regularly use, and I think quite rightly, to talk about the potential future benefits of e-health. E-health also means better coordinated care for patients with chronic or complex illnesses, reduced duplication of testing, less of a need for patients to retell their story every time they see a healthcare professional, and a more efficient use of time, staff and funding. And I was interested to hear Jonathan talking about how the use of e-health has made him more time efficient and more efficient generally. E-health the benefits have been recognised by health ministers since 2008, when in October of that year the National e-health strategy was launched by health ministers. The strategy detailed the shared commitment of all governments to developing electronic medication management, secure electronic messaging between healthcare providers, the use of healthcare identifiers for patients and providers, digital authentication and a national e-health records system. So what have the achievements been so far? That is a large and broad agenda, and I think the steps so far on this complex journey have been significant. Our progress on the foundation elements of the e-health system have been strong. In 2010, the Healthcare Identifiers Service commenced operation, and already more than 1.7 million individual healthcare identifiers have been matched and downloaded from that service. That's an essential part of the preparedness for the rollout of the e-health records system, allowing health professionals to accurately identify patients so they can safely exchange their records. We're seeing around 70% of community pharmacies now using e-prescribing. One prescription exchange service reported 4.2 million prescriptions dispensed in the week before Christmas last year alone. 1 week, 4.2 million prescriptions. We've developed specifications for the clinical software that healthcare professionals use that allow them to contribute to and access a patient's e-health record, including shared health summaries, event summaries and discharge summaries, and obviously that's all subject, of course, to patients' permission. And of course, at the moment, we're about to roll out the personally controlled e-health records. From the 1st of July, the National e-health record system will be that cornerstone of e-health in Australia. From the 1st of July, patients will be able to register for their own e-health records through either Medicare shop fronts or over the phone. I think the 1st of July is actually a Sunday, so you'll be able to do it on the phone on Sunday and in the shop fronts on Monday, lest I mislead anyone. And of course, mums and dads will be able to register for their kids. When they're registered, patients will be able to go online to view their record and add a range of basic healthcare information, including emergency contact details, the location of their advanced care directives, any allergies they have, any medications that they're on. And they'll also, from the beginning, be able to create their own healthcare diary area of an e-health record where they'll be able to add their own health-related notes. Powerful patient privacy controls are a critical part of the e-health record. From the start, patients will also be able to set those privacy controls to determine who can access that information and in which circumstances. For extra security, patients of course will be able to see a record, an access log that shows them every time their record has been viewed or edited. But that 1st of July step is the step, as Jonathan described it, of a long marathon. It's the first step, and this is a big project, it's an exciting project. I am determined not to rush it. It's not a matter of flicking the switch on the 1st of July and every doctor and every patient everywhere in Australia talking to each other from the 1st of July. The 1st of July is a day when people will begin to be able to start to register for their e-health records. We've always said that that rollout of the national e-health system would be gradual and would be in carefully managed phases. It's a sensible, responsible way to deliver a reform of such size and such complexity. The initial step on the 1st of July has always been about two key things. That's delivering the core national e-health system, laying the foundation, providing the building blocks, and secondly, allowing the first patients to register. Both of those things are on track. Over time, as more patients register and more clinicians decide to use these e-health records, more detailed and more sophisticated features will become available. Eventually, things like immunisation records, Medicare data, pharmaceutical benefits information, organ donation details and hospital discharge papers will become available as they can be added. And healthcare professionals will start to integrate patient e-health records with the software that they're currently using in their practices. So they'll be easily able to add new information to their patients' records. The Northern Territory introduced a form of e-health records a few years ago, and what their example shows us is that take-up is initially slow, but as functionality increases, the speed of take-up increases. And I was interested to hear that that's Jonathan's experience as well. We expect that that's going to be the case for the national e-health system as well. This project has been discussed, talked about, moved on slowly for a decade now, and I think we're at a time when excitement has really reached a much higher level. We're at the cusp of the national e-health record system becoming a reality for Australia. The rollout of this system will eventually change patient care very substantially. It'll start in the first instance, I expect, with the highest users of healthcare services. Jonathan described it as a marathon and said that there are benefits to e-health that will happen for our kids and our grandkids that we can't even conceive of today. And I was thinking about that when considering my remarks today, and I thought it made me think of the Snowy Mountains hydroelectric scheme, which of course is another one of those huge nation-building, forward-looking plans that governments invested in. When the Snowy scheme was first conceived, it was conceived of as an irrigation scheme. And now that Snowy Mountains hydroelectricity scheme powers most of the eastern seaboard. It's the largest producer of renewable energy in Australia and on the grid. So I think it's an interesting analogy to think about these large, complex infrastructure systems, and to think that when we conceive of them, we conceive of a whole range of benefits, and yet as we build and as we use, new benefits will become apparent to us, to clinicians as they work with the system, and our kids and grandkids will have a completely different experience of e-health to the one that we will start with. We're committed to building and investing in an e-health record system because this 21st century digital infrastructure will help revolutionise healthcare in Australia. For healthcare professionals, e-health records will mean easier and faster access to more patient information. That's good news for all clinicians, but perhaps GPs most particularly because they see such a wide range of people with such a wide range of conditions. We know clinicians will be at the centre of the smooth and efficient operation of the National e-health record system, and that's why we've supported GPs to prepare for e-health through practice incentive payments. In 2010 and 11, the government invested around $85 million in practice incentives, with around 4,200 general practices receiving up to $50,000 each. These practice incentive payments have ensured that over 95% of GPs are using computers and connected to the internet, which puts Australia at around the 5th highest computerisation of GP practices anywhere in the world. Today I wanted to detail some of the additional supports that will be available for GPs using e-health. I'm pleased to confirm that MBS consultation items will be available to GPs as part of providing continuity of care to a patient, and if they are creating or adding to a shared health summary on an e-health record, which involves taking a patient's medical history as part of the consultation. The Level B $35.60 benefit will be available for consultations that involve taking a medical history for less than 20 minutes. The Level C $69 benefit will be available for consultations that involve taking a detailed medical history for more than 20 minutes. And the Level D $101.55 benefit will be available for consultations that involve taking a more extensive medical history for more than 40 minutes. I want to confirm that use of longer consultation items will be seen as appropriate by the Medicare Australia Practitioner Review process and by the Professional Services Review in circumstances where there's clear evidence of patient complexity and there's documentation of a substantial patient history. I understand that some people have been a little nervous about these issues around the MBS, so I wanted to confirm that today and offer that clarification. I'm committed to a genuine partnership between our government, patients, healthcare professionals and the IT sector to deliver this important reform. Our 12 e-health pilot sites are an example of this collaboration in action. I'm happy to know that Julie's out there testing one for us right now because I'm sure I'll get the direct feedback. I've been visiting a number of these sites, including one in Brisbane last week, the Metro North Brisbane Medicare Local, and I saw for myself there how the new technologies that are being trialled and the strong partnership between healthcare and IT professionals is working for the good of patients. These pilot sites are breeding grounds of best practice, and I think we can learn a lot from what we're learning in the trial sites and roll those learnings into the national system. But I want to say that it's not just in these 12 trial sites that I'm seeing fantastic use of IT and fantastic work of clinicians to use the latest available IT for the benefits of their patients. Earlier this year I was impressed by Professor John Wilson's telehealth project and the potential for expanding in-home services, particularly for patients in remote areas or people who find it hard to travel to regularly see a doctor, particularly when they need regular monitoring or surveillance. I also went down to the Shell Cove Family Practice, which is one of our new GP super clinics, and I was looking at the terrific software they're using that allows them to search within their patient database for patients who may benefit from a particular intervention. They can look at people who are smokers and think, well, we've got this new information about cessation. How do we contact all our smokers and let them know of this new thing that's available? And I think just seeing how practices are already using IT for the benefits of their patient, already putting into action the things that we see as the practices of the future is terrifically exciting and reassuring. I think a growing number of Australians will come to see and enjoy the value of a national e-health record system, particularly as the functionality of that system increases and access improves. They'll see the benefits of managing their own healthcare and that of their family, and in creating a safer and more efficient and effective healthcare system. I talked earlier about anecdotes, and I heard another one from one of our national change and adoption partners the other day. The case of a Vietnam veteran, Peter Ryan, who spoke about, or he was rushed to hospital on a Sunday afternoon with what turned out to be renal failure. Before he was diagnosed, the emergency medics were forced to spend a lot of time trying to locate his GP, get access to information about what medications he was on. Peter said, "I could have died while the hospital staff were chasing my medical history." I think that those tales that we hear, you would hear from patients all the time, I certainly hear from people approaching me all the time, are such important illustrations of what it is that we're seeking to change in the health system with this rollout. Technology has long been a driver of significant advances in healthcare in Australia. Our ability to detect and treat injury, illness and disease, and our ability to protect and preserve life. The great majority of our healthcare professionals, GPs, specialists, pharmacists, allied professionals such as physiotherapists and psychologists, use computers regularly in their daily practice. Most of us have access to the internet at home. The real problem up till now has been that none of these computers have talked to each other. The government's National e-health records system and the foundational work that we're doing will allow that secure and consistent information sharing that makes the information in those computers much more relevant for patient care. Government's been working with the health profession and the IT industry to develop the common language and secure information transfer needed to make a real difference where it matters most, for patients in clinics, in hospitals and their homes across Australia. Thank you.